Good morning, students. In today's lecture, we would discuss about the remaining portion related with the anatomy of the meninges. So, in the previous lecture, we had discussed about the dura mater, that was the external most uh, layer that surrounds the brain as well as the spinal cord. We had discussed about its various foldings. Now, today we will talk about the remaining meninges, about the important potential spaces and their clinical significance. So, all this we had seen in the previous lecture, the functions of the meninges, the various layers and the foldings of the dura mater. Now, today we will talk about the middle meningeal layer, or the second meningeal layer, that is the arachnoid matter. This layer, this membrane is fine, it is delicate, it is in between the dura and the pia mater. It surrounds the brain as well as the spinal cord. It is not very tightly adherent to the brain, it is loose. It is a loose membrane, it loosely surrounds the brain, and it does not dip in each and every sulci of the brain. So, there are only few sulci that the arachnoid matter dips into, and from this arachnoid matter there arises small protrusions, finger like protrusions, processes which are known as arachnoid villi. And these arachnoid villi, they allow CSF to exit from the subarachnoid space and enter into the bloodstream. So in this image we can see this is brain with the meningeal layers. So the dura has been removed, which is the outermost and the toughest meningeal covering of the brain. So it has been removed. You can see the removed portion of the dura mater is also seen in the figure. You can see this. This is the dura mater which has been removed, and this thin delicate layer that loosely surrounds the brain is the arachnoid matter, and below this there is the pia mater, which completely is adherent to the brain, and it is very difficult to remove the pia mater from the brain. So the arachnoid, it doesn't dip in all the fissures of the brain, but there are certain exceptions. So the fissures that the arachnoid matter takes entry into are the median longitudinal fissure, the largest fissure, uh, and it is carried into that fissure by the falx cerebri. Also, it is present in the hypophyseal fossa, but it is not distinctly identifiable there, and it is also dips into the stem of the lateral sulcus, and in that stem it is pushed by the lesser wing of the sphenoid bone. It is separated from the dura mater with the help of the subdural space, and from the pia mater by the subarachnoid space. And this space is important, it contains the CSF and blood vessels also. Arachnoid matter, it functions to provide sheaths for the cranial nerves as far as their exit from the skull. It is also the arachnoid villi, that is the finger like processes. They take origin from the arachnoid tissue and they project into the cranial venous sinuses. They help in the absorption of CSF from the subarachnoid space. So the arachnoid villi, they will carry the CSF from the subarachnoid space, and it will reach the bloodstream. Between the dura and the arachnoid, there are certain small veins, and these veins will connect the venous system of the brain with the venous system in the dura mater. Next layer is the pia mater. It is the pia in, it means loving, and mater is mother, because it is the innermost very soft membrane covering, so that name has been given to it. It is thin, vascular, closely invests the brain, dips into all the irregularities, all the sulci and fissures of the brain. And in the cerebellum, the pia mater dips and forms the foldings uh, in relation to the fissures of the cerebellum. Again, the function of the pia mater is it provides the sheaths for the cranial nerves, and it also merges with the epineurium around them. It forms sheaths for the vessels, that is the perivascular sheaths for all the blood vessels that enter and leave the brain substance. It forms the tela choroidi, which is a web-like membrane. It is vascular, thin, formed by the folding of the pia mater, and later on this tela choroidi is lined by the ependymal cells, the neuroglial cells, and they form the choroid plexus. The choroid plexus is a network of cells, and they help in the production of CSF present in the various ventricles. Pia mater also helps in the degradation of the various neurotransmitters, and it prevents their prolonged action on the nervous tissue. Now, the various spaces that we had talked in the starting of this lecture. So, the extradural space, which is also known as the epidural above the dura mater, is a potential space between the inner aspect of the skull bone and the endosteal layer of the dura mater. The subdural space is the potential space between the dura and the arachnoid mater, and it is traversed by cerebral veins on their path for draining into the dural venous sinuses. And these can become actual spaces in case of pathological conditions. So, potential space actually means that although there is not an actual space that is present, but in case of any pathology, if there is a hemorrhage or there is any obstruction in the circulation of CSF, so all this fluid can get collected in these spaces, and these spaces can turn into actual pathological spaces. So that's why they are known as potential spaces, because they have the potential of turning into actual spaces when such conditions arise. Otherwise, normal conditions, uh, there is not enough space seen as such in between these layers, but in case of a hemorrhage, effusion, excessive fluid CSF present inside the cranial cavity, then it will get collected in between these spaces. So next, there is the subarachnoid space, which is space between the arachnoid and the pia mater, and it has a network of arachnoid trabeculae, arachnoid villi present, and this space surrounds the brain as well as the spinal cord. It ends at the level of lower border of the second sacral vertebrae. At the level of S2, the subarachnoid space ends. Contains CSF, and some of the large vessels of the brain. Cranial nerves also pass through this space. There are large arteries that lie in the subarachnoid space, and these spaces, they are also communicated with the ventricles of the brain through the foramen that we had already discussed when we had talked about the fourth ventricle. That is, in the roof of the fourth ventricle there are foramens, foramen of Megendi, which is a median foramen, and the foramen of Luschka, which are lateral foramens. So these, through these foramen, the uh, spaces, they communicate with the ventricles, and it leads to a free flow of the CSF, or free circulation of CSF from the ventricles to the subarachnoid space. At the base of brain and around the brainstem, the subarachnoid space forms some intercommunicating pools which are known as cisterns. They help to reinforce the protective effect of the CSF on the vital centers situated in the medulla. So these are the various, all the blue areas here are the various cisterns. They are formed by the subarachnoid space around the brain stem forms these cisterns. Now, some points of clinical significance uh, is the CSF that we are talking again and again. The cerebrospinal fluid has diagnostic as well as therapeutic utility. The extraction of the CSF, it is used for the biochemical analysis, so it has a diagnostic value, and also sometimes just the removal of the CSF can uh, um, it it has a therapeutic utility, that is it relieves the symptoms of raised intracranial pressure. So how to remove the CSF? There are three methods, that is from the ventricles, ventricular puncture, cistern, that is cisternal puncture, and the most common, the easiest method, and the most used method, most preferred method is the lumbar puncture, where a needle is inserted into the space between the third and fourth lumbar spines, that is between L3 and L4. The needle is passed and CSF is extracted from there. There is also a procedure which is known as lumbar epidural. This process is mainly used either for giving anesthesia or an analgesic, and in this the needle will only reach this epidural space and it will not go deep into the dura mater. So only up to the level of the epidural space the needle is inserted for either giving anesthesia or some analgesics. A very common condition, because we are talking about meninges, so swelling of the meninges, inflammation of the meninges, especially the pia mater and the arachnoid mater, uh, it is either bacterial, that is pyogenic, or it is secondary to the tubercular infection due to tuberculosis. So it is either tubercular or pyogenic, and the symptoms could be there could be fever, headache, a characteristic headache with the rigidity of the neck, and there are changes in the biochemistry of the CSF on examination. If the consistency or the various components present in the CSF, they also change. So that is why we were saying that CSF has a diagnostic importance, because in various disease conditions, the biochemistry, the consistency, the color, everything in the CSF, it changes, and that serves to diagnose various disease conditions. So that's all about uh, the remaining meninges. Thank you so much.